Understanding Pulmonary Arterial Hypertension. This is Patricia. She has a passion for dancing and loves to dance to her favorite music. About a year ago, Patricia started to find it difficult to climb the stairs to her apartment, becoming out of breath after just a few steps. She also felt tired and noticed swelling in her ankles. Patricia was diagnosed with pulmonary arterial hypertension, or PAH, a chronic disease that affects the lungs and the heart. The lungs and heart are connected by the pulmonary arteries, which carry blood from the heart to the lungs where it absorbs oxygen that is then transported to the rest of the body. In patients with PAH, the walls of the pulmonary arteries become thicker and stiffer, which narrows and restricts the flow of blood to the lungs. Just like in a compressed garden hose, the flow slows down and the pressure rises. PAH is high blood pressure in these pulmonary arteries. The right side of the heart needs to work harder to pump blood along the pulmonary artery to the lungs to pick up oxygen. This leads to less oxygenated blood flow into the left side of the heart and to the rest of the body. Over time, the increased pressure can cause the right side of the heart to enlarge and become weaker. This is why Patricia gets out of breath so easily. Patricia's healthcare specialist, Dr. Hardy, sees Patricia regularly in a hospital that specializes in treating patients with PAH to assess whether her disease is staying the same, improving, or getting worse. As part of the overall assessment, it is important for Dr. Hardy to recognize Patricia's risk status, to understand the likely course of her disease, as well as to help inform treatment decisions. Patricia's risk status is determined by several tests and assessments that Dr. Hardy will review regularly, including exercise capacity and World Health Organization functional class. At the moment, Patricia's PAH is stable and she meets intermediate risk criteria. But Dr. Hardy's treatment objective is for Patricia to meet low-risk criteria. As per the recommended goals set out by the European guidelines, being stable is not good enough if Patricia can't achieve her personal goal, to dance. Both Dr. Hardy and Patricia have a role in making treatment decisions, and they work together to find the best treatment to improve her symptoms. If Patricia's personal circumstances and priorities change at any point, she can speak to Dr. Hardy about adjusting her treatment. Treatment for PAH can either be one medication or a combination of medications. If the treatment path they start on doesn't help Patricia to feel and/or function better, or if she could not tolerate the medication, there are other options. Dr. Hardy could change the dose of Patricia's medication, start her on an additional medication, or switch her to a different medication. Patricia shares with Dr. Hardy valuable information about her lifestyle and how the treatment is impacting her life. This helps Dr. Hardy see her as a whole person, not an illness. Patricia also receives excellent ongoing support from her patient organization, where she can exchange experiences with other patients. Through sharing experiences with other patients and the support and information provided by the patient organization, Patricia feels less isolated and empowered to make informed choices, achieve her goals, and identify changes in her health so that she can take positive steps. As well as psychological and social support, patient organizations also provide valuable information about resources, such as European reference networks, which ensures patients with rare disease in Europe receive the best possible clinical care. Whatever path Patricia and Dr. Hardy take, their goal remains the same: to help make Patricia's treatment goals possible. If you need more information, talk to your PAH specialist or visit a patient association near you.